Hello guys, hello, welcome to my presentation, welcome to my channel. Just a quick one. This is a question that I was asked by one of my students. They requested me to talk about the phases of a crisis, phases of a mental health crisis. Okay, so a mental health crisis has four phases. There are four phases in the mental health crisis. So these phases are as follows. The first phase is called pre-crisis phase. Pre-crisis phase. The second phase is called the crisis phase. The third phase is called the response phase. Then the last phase is called the recovery phase. Okay, so in the pre-crisis phase, this is a phase where an individual is exposed to a stressor, is exposed to a triggering event. This triggering event could be receiving of bad news, for example, a new diagnosis of a chronic condition. It could be cancer, it could be HIV/AIDS, it could be any other chronic condition that the patient has been diagnosed with. It could be loss of a loved one, it could be loss of a job, it could be loss of anything. Okay, that's in the pre-crisis phase. So in the pre-crisis phase, the most important thing you should never forget talking about is that this is a phase in which bad news is received. Okay, this is a phase in which an individual is exposed to a triggering event. Okay, that's in the pre-crisis phase, phase one. The second phase, which is the crisis phase, this is a phase in which now an individual becomes confused. Their anxiety escalates from mild to severe in panic states, panic levels. Okay, so the individual becomes confused and they are at high risk of self harm or harm to others. Some individuals may become aggressive or violent, and others may receive and others in phase two may initiate what we call the flight or fight response, where an individual decides to try and escape from the situation, or they try and put in some resolutions to fight and try and resolve the situation. That's in the crisis phase. Okay. The third phase I mentioned is the response phase. In the response phase, this is where now an individual initiates certain responses, puts in certain interventions, trying to resolve the situation. Okay, usually an individual may try to initiate previous coping strategies that they initiated before to see if they could work. And usually in this phase, in the response phase, an individual will need support actually from external uh, from external support. They will need external support. Okay, so with this external support, if the support is adequate, an individual will go into recovery. They'll recover from this crisis that they were suffering from. Okay, so um, the kind of support that is initiated will help the person recover. Okay, now the recovery of this person is usually two-way, can be two ways. Okay, now and the recovery is the fourth phase. So recovering, the person could recover to become better than they were before, or the person may recover to become worse than they were before. Okay, so the person may recover to become better than they were before because they have learned something from the experience. They have learned something, they have learned a lesson, they have learned how to handle the situation So the person may recover to become better, or the person may recover to become worse or poorer than they were before. Okay, so the person's level of functioning may reduce or may increase after recovery from this crisis. Okay, so in the recovery phase, the person just gets back to their pre-crisis phase or to their normal phase before they suffered a crisis. Okay, before they went into a crisis stage. That's in the recovery phase. Thank you so much for listening to this short presentation. Please, if you are a new member on this site, support me by subscribing to my channel. Thank you so much.